morning. I'm Dr. Borgarkar and I'm at the Bifurcation Club of India meeting in Mumbai. And today morning I'm in conversation with Dr. A. Madhavan, who is Director of Cardiology Department, Vellamal Medical College, formerly Senior Consultant at the Apollo Hospital Group. Dr. Madhavan is a pioneer in interventional cardiology in Tamil Nadu. He is involved in major clinical trials. He is a fellow of the ACC, ESC and the SCAI. So good morning, Dr. Madhavan, and welcome to this meeting.
Good morning, sir.
Dr. Madhavan, one of the other aspects regarding heart disease is high blood pressure or hypertension. So could you elaborate on how important this problem is in our patients?
People think high blood pressure causes some symptoms. That's a wrong notion. It is an asymptomatic disease. Even if you take blood pressure of 200, 110, they may not have any symptoms. But unfortunately, many people think high blood pressure. I don't have pressure, sir, high blood pressure. I have no symptoms. I am all right. But the patient has got a very high blood pressure. They think high BP means it gives a headache and so many other symptoms. It is not so. And you must remember that above the age of 40, 30 to 40% of Indians have high blood pressure. And high blood pressure is one of the cause for stroke, number one. Then heart attack, then kidney failure, and blood vessels disease in the lower limbs and upper limbs, so on. So high blood pressure is a very important entity, which is neglected entity. So anyone beyond 18 years should be evaluated periodically for high blood pressure. If there is a family history, annually they should check BP, and after the age of 30, even if the person is not suffering from high blood pressure, a periodic BP monitoring of once in 6 months is mandatory.
So hypertension as such or high blood pressure has no symptoms, and it's only that when you periodically recheck yourselves, you will be appraised whether you have high blood pressure or not. So how do we treat this high blood pressure problem?
First, the moment if we know whether the patient is hypertension or not. So what practically happens in the hospital is that a person comes to the clinic, the nurse or the physician assistant or even the doctor takes the blood pressure 160, 100. I think that's a wrong way of doing it. When the patient rushes to the hospital, anyone who rushes to the hospital, even you and me, we will be apprehensive. So first relieve his apprehension, give some rest for some time, and ask him whether he has taken coffee, tea, has he smoked, because all these things will increase the high blood pressure. So give him some rest. And if he has taken coffee, tea, I think we have to wait and take the blood pressure measurement after some time. After doing all these things, take the blood pressure in a proper position. Proper cuff. What we do is, we use cuff, same cuff. Cuff means something is wrapped around the hand while taking the blood pressure. Same cuff for every patient. Obese patient, thin patient, or a patient with ideal body weight. So we have a different cuffs for different patients. That is number one. When you should take BP, what kind of cuff you are using, these are the most important things. And the first reading should be discarded. And second, third may be averaged. If you have a semi-automatic machine, again the first reading should be discarded, subsequent reading should be averaged. This is a very important message.
So is there any advantage of checking the blood pressure at home in your home surroundings, and would that help in some patients who are anxious when they come to the hospitals?
Yes, sir. That's a very good question. The home BP is very ideal. And if the person is a high blood pressure patient, okay, we label them as a high blood pressure patient. We have given some lifestyle modification. still BP is not under control, or we are not very sure whether the BP is under control, I strongly suggest those patients should be put on 24 hours BP monitoring. That is called ambulatory blood pressure monitoring, where doctor or technician fixes a cuff and it is inflated once in 15 minutes or half an hour throughout the day, and we know the trend when the BP is low, when the BP is high, and accordingly we can adjust the medications. This is a very important point.
So Dr. Madhavan was discussing about checking the blood pressure in the clinic or in the hospital, at home, and the last thing that he discussed was ambulatory blood pressure monitoring, which looks at the 24-hour trends in blood pressure. Right.